So when we think about addiction, we often think about two different categories. We think about the very wealthy, the elite, how they might get into cocaine and stuff like that. We try to understand why, because they have everything. And then we think about the destitute, the lives of despair, the people who seem to have nothing and want to escape reality. These are not two different categories of people. There is absolutely no difference between the elite athlete or the very, very famous actor or actress and everyone you meet on the street. The difference is circumstances. We don't know how many poets, lie dead in military cemeteries, how many authors and great scientists and all that. The same thing when we're talking about the people that you deal with, when you're trying to help what are considered regular people or average people. No human being is ever average, and that's very important to remember and realize because the average person will never walk through your door. Each person, even when it comes to basic biochemistry, there's over 140, as I discussed last time, there's over 140 different genetic variations for cytochrome P452D6. So how people process opiates is different, is very different. You get two of those genes, one from each parent, and one cell might activate one and another the other. And epigenetic changes from your grandparents and parents can affect your molecular processing. And all these things are enormously complicated. And then there's 80 different variations of the opiate mu receptor, which responds to these drugs. But there are other drugs also, and ketamine is one of them. And we've talked about xylazine and other drugs like that and how it affects. But let's talk about ketamine today, and let's talk about Matthew Perry and what was going on with him. Now, the DEA, the head of the DEA, Ann Milgram, put out a statement saying that Matthew Perry got addicted in a doctor's office and died at his home. That's not true. Matthew Perry did not go to a ketamine clinic and get addicted. Matthew Perry was suffering from addiction, and he went to a ketamine clinic to get treatment. So why would ketamine help someone with addiction? Why was Matthew Perry addicted in the first place, and what substances was he drawn to? This is a very big clue as to what your client is suffering from. If your client is addicted to amphetamines, there is an extremely high possibility that they had untreated ADHD as a child and that they are, quote, self-medicating. And we'll talk about the dangers of self-medicating. And they took an amphetamine and it made them feel what all the rest of us without ADHD feel all the time: focused, alert, all that. And they can handle outside stimuli. And so they grabbed onto that feeling and they want to repeat and continue that feeling. The problem is, when you're using a drug on the street, you're not getting a standardized dose. And also, people aren't good at knowing what they need. Otherwise, my cheeks would be a little more narrow and I would, I'd look like, what's his name in the Blue Steel comedy. We have trouble policing ourselves. We expect others to. We're always very inflexible. How dare you? I don't know how many times in the ER, I've seen the police bring in someone who had overdosed, and we reverse that overdose with the Narcan in the emergency room. And I hear the cops say, "I don't even know why you bother. They're just going to do it again." And I'm like, "Okay, you're about 40 pounds overweight. So come in with a heart attack, I'm going to look at you and say, I'm not going to bother because you're going to have another donut? No, no. I'm going to treat your heart attack. I'm going to treat their overdose. This could be their chance. This could be the time they wake up. It's not our place to decide when someone's had their last chance, right? That's determined by fate. Shouldn't be us. So, Matthew Perry. Matthew Perry suffered from severe depression. He always had. From his earliest days of acting, if you read his book, there was a family history of depression and alcoholism. And he suffered from depression because when you are depressed, alcohol helps you feel better for a little while. Right? And I used to wonder, how can alcohol do that? How can alcohol cause you to feel better when it's a depressant? Shouldn't it make you more depressed? Well, the first thing alcohol depresses are the cells that are holding back dopamine. So remember, addiction circuit, ventral tegmental area, nucleus accumbens, dopamine projections. The ventral tegmental area is the targeting center. The nucleus accumbens is the reward center. You see something that has been good for you long term. Maybe you see a steak, and the ventral tegmental area sees that steak, responds to that steak, and sends a little bit of dopamine to the nucleus accumbens, saying, "See, looking at that makes you feel good. If you had it, you would feel even better." Right? And then we go get it. Now, quite often, once we get what we want, we're not that happy. Right? We don't get a huge burst of endorphin. We get the endorphin when we target what we want, not when we get it. That's why we see the cheesecake and we feel, oh man, that would be so good. You eat half the cheesecake and you're like, I really wish I hadn't done that. Right? So that's how this system works. It always makes you want to get it. It doesn't necessarily make you happy once you have it. So those of us who grew up poor or whatever, we know what it's like to not have what you need. And we think of Matthew Perry, who died with about $125 million in the bank. And we think, how could this man possibly be unhappy? He could travel anywhere, do anything, buy anything. But there is a problem with that. When you can travel anywhere, buy anything, then what do you really want? Faster car, speed limit doesn't change. Spouse, you can go out and get somebody who wants to spend time with you. Now you're rich. Now you're worried. Are they after me just for my money? Just like beautiful women often have to wonder, and beautiful men, is this person only interested in me for my looks? If I get cancer, my hair falls out, and I don't look good, are they going to leave me? Right? Well, a lot of comedians and actors and just people you will meet on the street, a lot of your clients, even the wealthy ones, will come in and they will say, I'm an imposter. If people knew who I really was, they wouldn't like me. And Matthew Perry felt that way. He felt like all this fame and riches should have gone to somebody more worthy because he didn't deserve it. And of course, we can say, well, that's not true. You were a good actor. You made everybody happy. You made everybody laugh. You made all our lives better. You deserved what you had. But he doesn't feel like he did. Now, that's part of depression. Depression causes anhedonia. Anhedonia means nothing feels good. So nothing made him feel good. And so he started self-medicating with alcohol and became an alcoholic. So he was addicted long before he went into a ketamine clinic. He also tried opiates, and they made him feel better too. Of course, they mimic the natural beta endorphin in our brain. They bind the opiate receptors, they activate them. They give us a feeling of euphoria so we can feel good whether our brain wants to or not. Now, why are some people's set point? Our mood has a set point like a thermostat. Why is it set so low on some people? Bipolar people, it does this, right? But with depression or unipolar bipolar disorder, where it sort of drops down and comes up to normal and then drops down, you've got type 1 and type 2 bipolar. Some people don't have the manic episodes. They go normal and they drop back down. And then you put them on an SSRI for depression, and all of a sudden, woo, they have their first manic episode. You're like, oh, son of a gun. I thought they had regular depression. They don't. They've got bipolar. Totally different diseases, treated differently, right? One needs a stabilizer, like an anticonvulsive or something like that, or lithium, which is still used today in some people. The other one might need a selective serotonin reuptake inhibitor or a serotonin norepinephrine reuptake inhibitor. But what do you do when someone is suicidal? Someone comes into you with depression and they're suicidal and they're saying, I'm having thoughts of killing myself. And you say, oh, well, first you do your counseling, right? 50-50, sometimes 70-30. Let them know someone cares, someone's there for them. You talk to them, you tell them, you have them sign a contract. You are going to call me before you act on anything. People will do that. People will honor their word 99% of the time. I don't care who they are. I don't care what you think about them. If they sign that contract, son of a gun, now I got to call. And sometimes you'll get calls, right? And the suicide hotline should always be a number that they get. But when you put them on an SSRI, the doctor's going to put them on an SSRI. What does that do? That increases their motivation before it increases their mood. So someone feels like killing themselves and they just haven't done it yet because they're unmotivated. So you increase their motivation, norepinephrine, before you increase their mood with the serotonin, and they kill themselves. So there's a higher rate of suicide after you start an antidepressant. This period of time lasts about 6 to 8 weeks. Is there any way to get past that? There is. It's ketamine. Ketamine reverses depression within hours. You go from feeling like you want to kill yourself to feeling happy and positive. You can see the changes on the neurons. The dendrites on the neurons are kind of smooth. They don't have a lot, they're not ready to make new connections. And under the microscope, when you give mice ketamine, these spines grow. They're ready to make new connections. They're ready to learn new things. And that's what healing is all about. Learning a new pattern of behavior over that old one. Learning to think about things in a new way with narrative therapy, cognitive behavioral therapy, thinking about what you're doing, mindfulness therapy, living in the moment. Because there are networks in the brain, and these networks determine our perceptions of the world. And one of those networks is called the default mode network. So scientists are studying the brain, and they put someone on a functional MRI, and they're watching these networks fire up, and they're getting ready to test them, and they say, hey, everybody's showing the same areas of the brain active when we're not having them do anything. What is that area? Well, I mean, what's that system? Well, default mode network, right? Because they're in the default mode, as in you're not actively doing anything. You haven't started the test yet. Well, they're daydreaming, they're thinking in their head, they're contemplating their inner self, introspection as opposed to extrospection. So this is the default mode network. And what happens with people with depression? They get stuck in the default mode network. They are constantly thinking about their internal state, how bad they feel, how other people might perceive them. When our default mode network is too active, we walk through the school thinking about all those people laugh. They're probably laughing at me. I heard somebody talking. They're probably talking about me. Everything's about you. That's why mindfulness and cognitive behavioral therapy can help these people break out of it, because it tells them, look at the world. Forget about you. You're just a small cog in this. Go stare at the stars and realize how small you are in the universe, and focus on the world around you. That breaks you out of the default mode network, because the network that looks out, right, is sort of the task-directed network. We all know this. Right? The best way to break out of a depression is to stay active. Take a good walk every morning. Help people who have problems. Help someone who's worse off than you are, and you'll feel great. Right? You'll start to feel great. It's a healing process. So Matthew Perry has severe depression. He goes to the ketamine clinic. They give him ketamine, and he feels better. He feels better. And he goes home. But the ketamine clinic that was treating him IV, they were doing everything right. It still takes time. You might need 5-6 doses of ketamine on a monthly basis, right? Because the effects of ketamine in some people, their depression is very resistant. Ketamine wears off in 3 to 4 weeks when they come back. Now, what's the problem with Matthew Perry? He's rich. He's rich. And so he says, I don't want to wait 3 to 4 weeks. Ketamine made me feel better. I want more ketamine, and I want it now. He's got a personal assistant. He tells that personal assistant, I want some ketamine, go get some ketamine. Well, that personal assistant goes to the ketamine queen, who I think will probably spend the rest of her life behind bars. Ketamine queen gets ketamine for all the Hollywood elites. Ketamine's like a Schedule III medication. It's not that strictly policed. It's not that hard to get. It's available through compounding pharmacies in a pill form, which is relatively safe. It can be given IM as an intramuscular injection, or it can be given IV. Well, he's probably not doing IV at home. They're probably doing IM shots, right? So they found some doctors who, and I don't, these are allegations. I don't believe anything that the government says when they go after somebody. But one of the doctors has pled guilty, and I read his guilty plea. So here's what happened. Matthew Perry said, I want this stuff. The ketamine queen went to these doctors and said, hey, can I get some injectable ketamine? They said, hey, we can't be handing that out to people. That's a big risk. And we're supposed to be using it in our clinic where we monitor their blood pressure. That's the other thing about ketamine. We've used it for 40 years as an anesthetic. But when you give someone a shot of ketamine, their blood pressure can spike. Now, we like that in the emergency room, because people come in all busted up from a car wreck, and we're like, their blood pressure is 60/40, and we still need to knock them out. Ketamine. Boost their blood pressure and knock them out, right? But what if your blood pressure is normal? It spikes. Well, one of the doctors had given Matthew Perry a shot in a parking lot and monitored his blood pressure and said, that went pretty high. Let's give you a whole bunch to take at home and let your assistant give you these shots. So no nurse, no rescue pack, right? No AED, nothing to put on in case they have a cardiac arrhythmia from a blood pressure spike. What does a blood pressure spike make you do? I don't know if any of you did this as a kid, but if you take 3 deep breaths and hold your breath and someone squeezes you from behind, you pass out like a light. My brothers and I used to do it all the time. I don't know what my IQ would have been if they had not, but anyway, we used to do it because we thought it was funny. You'd fall over, you'd pass out, you'd shake a little bit and wake up. What's making that happen? High blood pressure. When you take a deep breath and I squeeze, your blood pressure shoots way up. There are baroreceptors in your neck, pressure receptors, and they suddenly detect that your brain is getting a 600/400 blood pressure reading, and it drops your heart rate down to 0. You pass out. Then you hit the ground. It waits a little while, and then it resets. Starts back up slow, 30, 40, 50, 60. What happened to Matthew Perry? He got a shot. His blood pressure went up. They left him alone in the hot tub. He passed out. Matthew Perry did not die from an overdose of ketamine. Ketamine is extremely hard to kill someone, right? That young man who died when the police were arresting him and the EMTs gave him 800 milligrams of ketamine, he died, one, because the EMTs were stupidly trained. A man my size, 220 pounds, can withstand 1 to 1.5 milligrams per kilogram without going unconscious. That's 150, 100 to 150 milligrams. They gave that kid 800. And he weighed 130 pounds. He didn't weigh 220. So Matthew Perry did not die from a ketamine overdose. What killed Matthew Perry? His depression killed him, and his wealth, because he had access to enough money to convince doctors to charge him $2,500 per $12 vial of ketamine. And that's why those doctors are almost certainly going to go to prison. And I have no problem with that, right? Now, you buy the ketamine, when you infuse it, you charge more, make a profit. That's okay, reasonably. But when it goes out the back door without a prescription, without a proper chart, that's the definition of criminal medical behavior. Right? That goes back to the first case. The first doctor prosecuted under the Controlled Substances Act was in 1974, and that was that doctor that was selling methadone by the milligram. So what will kill your clients? Self-medication will kill them. That's why doctors are not allowed to treat themselves or their immediate family, because we cannot be objective when it's us. We cannot be objective when it's our immediate family. So we need to be able to convince the client that it is not safe to self-medicate. Now, some people will say, well, if they use methadone or they use buprenorphine, they're trading one addiction for another. Yes, to a degree, maybe. But they're really trading an addiction for a treatment. And if they get that methadone daily, they're not going to be dying from that. They will not. So you are saving their life and giving them a chance to get their life together. And that's all you're doing. That's all you're doing, right? We can be pessimistic and say, well, it doesn't always work. No, it does not, but it works 3 times better than not. Using medication-assisted therapy to help someone get away from addiction is 3 times more effective than not using it. Now, if they don't want to try medication, let them go their way. Some people can tough it out. And some people don't have that hard of a ride. So some people, they say, I don't need methadone, I don't need buprenorphine, I don't need anything, just counsel me and let's give this a shot. Don't insist that they use something they don't want, because maybe they don't need it. Everybody's an individual. Let them have that chance. If they succeed, great, give them a high five. If they don't, they come back and say, oh man, I tried and then I messed up this weekend. Say, well, do you want to try again without it, or do you want to try something that might help control it? Now, methadone is reserved for those who just cannot stop. They cannot stop, and you don't want them to die. Buprenorphine can be used outpatient because it has a respiratory ceiling. It won't stop their breathing. You can use small doses, and over time, because the buprenorphine doesn't crank those receptors up all the way, those mu opiate receptors that have been downregulated during the period of overuse start to upregulate, and you need less and less buprenorphine, and you can taper most people off. Most people, not all people. Some people need it for the rest of their lives, or they will relapse, in which case Think of it like blood pressure medicine or insulin. We don't tell diabetics, you've had enough insulin, you've been on it for 6 months, we're going to stop your insulin. You're insulin addict. No, we don't do that. We shouldn't do that with these medications either. At the same time, we shouldn't just keep them on it indefinitely. We should try to taper them down and see if it's possible. Okay? So these are the things that you're going to be dealing with, and you're going to see people just like Matthew Perry, probably without all his resources, but it doesn't take that much to be able to afford things on the street. Now, when it comes to other addictions, right? Amphetamine addictions, is there anything the doctors can use to help with that? Well, it turns out that there are medications off-label, just like ketamine, that seem to help with stimulant addiction that are not themselves stimulants. Just like a doctor might prescribe clonidine if someone is in opiate withdrawals and he doesn't have access to methadone or buprenorphine, might give clonidine, a blood pressure medicine. Why? Because it works just like xylazine, causes just a tiny release of dopamine, which will moderate some of those withdrawals and help them get through it, help them tolerate it, help them not be in agony. So clonidine can be used. For stimulants, right, there is a medication called bupropion. It's also called Zyban. It's used to help people quit smoking. It's called Wellbutrin when you treat depression. What does it do? It boosts the norepinephrine levels, as well as some of the serotonin, but mainly norepinephrine. And it's that effect that moderates the reaction to the amphetamine addiction. So if these people had taken a small dose of amphetamine, because amphetamine salts is a medication, that's what Ritalin is. Ritalin and Concerta, they are amphetamines. It's a medication. You take the right dose for your size, for your medical problem, you are able to function better and you're healthy. It's fine. But people self-medicating, take too much, people getting stuff on the street, don't know what they're taking, and things start to oscillate. If they go too high, take too much, the body responds by taking these receptors down. Now you've increased your tolerance, so it's going to take more for you to have the same effect next time. You're going to go into withdrawals if it's stopped abruptly. These are physiological changes, not necessarily signs of addiction. When you lose control and cannot stop, that's when you're fully into addiction. Okay? So this will happen with all drugs of abuse, and it can happen with gambling. It can happen with the internet and with other things too. Now, just because you like something doesn't make it an addiction, and that's what the DEA got wrong in their press release. He kept using ketamine because he was addicted to ketamine. No, he kept using ketamine because he was treating his addiction, and he overtreated himself. And these unscrupulous people allowed him to. Now, do I blame the assistant? Not really. He'll go to prison over it, but the assistant was told by the doctor how to give the shot. He would assume the doctor would not do something unsafe, right? Now, there's always a risk and benefit. I put you on an antibiotic, you might die from it. Hundreds of people every year die from penicillin or clindamycin or cephalosporin. Anything I give you can kill you. The difference is when I should reasonably know that it can kill you. Now, and whether or not I advise you of that risk. So whenever you start someone on opiates as a doctor, you tell them, hey, these can be dangerous medications. You can develop an addiction even if you've never had a problem with anything in your past. And these are what you watch for, and this is what you tell us. That's another thing the DEA doesn't understand. There's no medication you can use that does not have risk, because there's nothing you do in life that does not have risk. Every time someone rides a motorcycle, they are risking death because they enjoy the way it makes them feel. That's not addiction. That's life. Right? My brother just had a bad motorcycle wreck, 55 years old, called me just a few days ago and said, this car stopped real fast in front of me, and I was looking in the rearview mirror. I looked up, I couldn't stop. Locked it up, it flipped me, my head impacted the ground and knocked me cold for like 10 minutes, but luckily I had my helmet on, and helmet's all busted up, but I'm okay now. And I said, are you going to keep riding? No, I'm selling that. Right? But he could have been dead, and then he doesn't get a second chance. So our fight is to give these people that second chance, to keep them alive long enough to realize I shouldn't be doing this. It's not worth it. Now, should we ban all motorcycles because they're objectively, scientifically stupid? I rode from 15 to 32. I started working in the ER. I'm like, oh, that looks painful. I don't want that. Oh, that one looks painful too. You know what? I'm going to quit riding. I got kids. right? When you're 19, you say, the pleasure I get from writing, my reflexes are fast, I bounce, I heal fast. I'm ready to take that risk. That's your right as a human being to weigh the risk benefit analysis as long as you know the risk, right? And a big part of educating your clients is to make sure they understand the risk because somebody out there is selling them something saying it's safe. Go ahead. Just like these doctors who knew ketamine causes blood pressure spikes, who knew that even the nasal spray they use in the VA can only be used in a controlled setting so you can watch that person. I've used ketamine in the emergency room. I've used ketamine for depression, always. With blood pressure monitors, pulse oxes, an AED or defibrillator right there. I would never do it otherwise. And there are medicines that we give people to take at home that can kill them. Insulin can kill you. Insulin will drop you dead. Take too much of it. Right? But nobody enjoys the way insulin makes them feel, so no one is prone to taking too much for the joy of taking it. But if it's a medication that can make you feel good, and ketamine does, then people will be prone to overusing it, and we have to more strictly control their use of it. Right? Now, the ketamine tablets, they are very slowly absorbed. It's almost impossible to overdose on it. You just feel weird, get sick, and throw up. So the compounded ketamine capsules, but none of that's FDA approved. Why not? Why is ketamine not FDA approved? Why is the nasal spray approved for the S enantiomer of ketamine, but the racemic mixture, which is $12 a bottle, it's not approved, but the nasal spray that's $2,000 for a tiny little vial, why is that approved? It's money. It's all about money. The racemic mixture has both S and D ketamine, and you inject it, and it works exactly like the nasal spray. The nasal spray is not magic, but ketamine's been around 40 years. It's generic. It's cheap. The drug company says, we're not spending bucks to prove that it works for depression. We're not spending bucks to prove that it works for addiction because there's no money in it for us. Right? And this is where I think the government should step in and go ahead and do those tests, but they don't. And so the doctors start using it off-label. Is that illegal? No. The Supreme Court has clearly said doctors have the right to use medications off-label because there would be no innovation in medicine if we couldn't. There would be no discovery of side effects, right? Believe it or not, one of the most valuable drugs ever made was a side effect, right? Talk about Viagra. Viagra, they make a huge amount of money. It was a blood pressure medicine. It was being used as a blood pressure medicine. Someone noticed the side effect and said, guys, we're going to be comfortable. And these are the way we advance medicine. So ketamine is an amazing treatment. It can keep you from killing yourself. It can fight your depression. It increases neuroplasticity and helps you break out of old habits. It can be used with some painful conditions like chronic regional pain syndrome, CRPS. Like if you watch the Maya movie, you'll learn all about it, and you'll hear the two doctors argue about ketamine's good and ketamine's not good. And one doctor's saying ketamine is not approved for that purpose, and he was using very high doses. And you have the other doctor saying, I know it's not approved for that purpose, but the studies show it clearly works for that purpose. And I'm using super high doses because this is an unusual patient. And you can't treat people with a cookbook. You have to adjust it to them. And then you'll hear Maya herself say, this helped me. This helped me. I'm able to walk around and do better stuff now. So ketamine can help with phantom limb syndrome because you've got this repeating circuit creating this pain, and then you give a shot of ketamine. The ketamine says, make new circuits, be ready to learn new things. And it says, you know what? That leg's gone. Might as well just quit firing. And it learns a new pattern. So lots of things ketamine can be used for. Okay, so people will come to you for advice, for treatment and all that. The bond with the counselor is probably 90% of them healing themselves. The rest is everything else that we do and that they do. Does anyone have any questions?
Good morning.
Yes, ma'am.
Hi, Dr. Parker. And I have a question about the Spravato. So that was the one that was approved for intranasal usage. But I have a question about that one. So anytime, and I just want to make sure I'm clear, you said anytime a patient gets administered esketamine or ketamine, no matter the session, the start, every single time it has to be a waiting period. They have to come in to be seen to get it administered and assessed afterwards
That's my
every single
understanding,
time.
that there has to be a period of observation. They may change that because realistically, it's not a big dose. It's like 56 milligrams, right? And I said someone my cut my size can have 150. So it's like maybe 56 milligrams to the nose. Now it's going straight to the brain. So understand that when something is intranasal, it goes straight to the brain. That's why people snort drugs, because
Mhm.
the olfactory tract goes straight to the brain. There's no mediator, and that's one of the reasons why you can use Narcan in the nose. And they have a new Narcan, an intranasal Narcan that they're making a little spray bottle to use like that, and that's why they're using the ketamine like that, because it works as well as an injection, and in some ways a little bit better. Since it goes straight to the brain, they can use lower dose and have the same effect.
Okay.
So they have moderated that dose to not cause a hypertensive spike, but because it does in some people, that's what they require. Now, I'd have to look and see if they still require that because these requirements are changing all the time.
Okay. Are there any concerns about missed doses? Because thinking about the time frame, every couple of weeks they have to come in. If they miss a dose, are there any concerns to be
No,
alert about or tapering to if they want to stop?
if they had suicidal ideation, then you would have to worry that that might come back if they hadn't completed treatment.
Okay.
So it takes usually it takes 2 or 3 doses of ketamine, and that's why that clinic was doing like sometimes 5 or 6 or even 12. And some people have to come back every 3 months for kind of a tune-up
Okay.
point
Okay.
because their systems naturally gravitate toward a depressive state. And so there won't be any serious side effect. If you're on beta blockers, you stop them abruptly, you can have a heart attack or stroke because your blood pressure will go
Hmm.
crazy. None of that. None of that.
Okay.
And I will tell you this, a good walk every morning, aerobic exercise every morning, about a 2-mile walk, beats any antidepressant on the market. It beats Cymbalta, it beats them all. It does a lot of the same thing ketamine does. It increases the spiny projections on the dendrites and gets the brain ready to learn. It increases neurogenesis, so you make new brain cells, and those wire themselves in and learn new things, and get you out of what you're stuck in. But getting someone to come in for a spray in the nose is easy, and getting someone to walk every morning
Right.
is harder, especially when they're depressed, right? We say, well,
Right.
if you'll just work out, eat right, exercise, and meditate. Well, if they have the motivation to do all that, then they probably wouldn't meet the definition of depression.
Absolutely. Thank you.
You're welcome. Ms.
My
Tracy?
question is, you may have hit on this, the over-the-counter ketamine, the dangers, and is it, you talked about people who might not get it prescribed and people who just say, I'm going to go to the drugstore. I mean, the gas station.
Yes. Now, what you see in the gas station, there's a lot of weird stuff at gas stations. I
Yes.
saw THC at a gas station. I'm saying, what? There's no state where you can just have THC for sale like this. And again, well, it's Delta 8 tetrahydrocannabinol. The law says that you cannot have Delta 9 tetrahydrocannabinol in any product, blah, blah, blah. It's federal law. It can't be over 0.3%. Well, they didn't say anything about Delta 8. And that plant made a little bit of Delta 8, so they cultivated the plant to make a whole bunch of Delta 8 tetrahydrocannabinol. It's a little milder than the Delta 9. So what people are vaping and walking around with when they're buying the THC, why aren't they rolling all those? It's Delta 8. It's not banned yet. So they are not getting ketamine in the gas station, but they might be getting real ketamine from some diverted source. Right? If it's in pill form, it's probably not ketamine because it's going to take a long time to kick in. If you take a 25 to 50 milligram capsule, if I were to take one of those, it would take hours for it to kick in. So that's not what you see them doing at parties. I don't know if they're snorting ketamine, probably injecting it, ketamine. But ketamine is not a big drug of abuse. You're not going to find people who say, I'm hooked on ketamine, I just can't stop. They won't say that. Because once you take ketamine, you're not going to want it again for weeks, usually. So some people say it's a dissociative anesthetic, so they're taking it to escape the world. No. They feel like they want to escape the world because of the underlying cause of their depression or whatever else they're suffering from. but they're taking the ketamine because it's helping them fight that. They're not going to want, it's like the cheesecake, right? I might eat a pint of Haagen-Dazs ice cream or Ben & Jerry's Cherry Garcia. I might eat a pint of it. I'm not going to eat two. Once you have one, you've satisfied that urge and realized I probably should have moderated. Right? Same thing with ketamine. Now, some drugs don't do that. Right? Sometimes you want more and more and more, and you'll kill yourself. But people usually don't smoke themselves to death, and they actually usually don't heroin themselves to death. All of these deaths that we're seeing are from one of two things. The prescription drug deaths are usually from people who have severe chronic pain or being treated with opiates and they decide, I can't take this anymore and I don't want to shoot myself and make my family find that. So I'm going to take a whole bunch of my pills and do myself in. Those are where the prescription drug deaths are. The other, quote, synthetic, quote, prescription drug deaths, those are all fentanyl. Those are all laced tablets. So someone thinks they know what they're taking. They think they're taking the regular dose of heroin. It's not, it's fentanyl, and they die. Or it's got xylazine, and they die. These are poisonings. These are not overdoses. Right? Like that poor girl, 19 years old, college student studying law, took one Percocet at a party because someone gave it to her. She wanted to see what it felt like to take a Percocet. She died. It was not Percocet. It had no oxycodone in it. It was fentanyl. Had it been Percocet, it would have never killed her. No 10 milligram oxycodone can kill anyone. Right? So a man my size, it takes 1,600 milligrams per deciliter to kill someone my size. So I would have to take about probably 6 of the 30 milligram tablets at once, never having been exposed to any opiate, to kill someone my size 50% of the time. The other 50% of the time, I'd live through it. I'd wake up and say, oh, it's Tuesday. What happened? Right? So had she taken the Percocet, she would not have died. But because it was fentanyl, she did die. So these are almost always tragedies where someone did not intend to die. Now, the other ones I said are, sort of the death of despair where they feel like there's just no hope. What could help them with that? Ketamine could help them with that. So you're not going to find people saying, I've got to get my ketamine. You can find, just like coffee, right? People want their coffee. They're not going to mug grandma over it, usually. Well, that's what happened to Matthew Perry, and he was a human being just like everyone else. He was not special in the ways that would make him immune to these problems. And all of his wealth and access to everything did not insulate him from the depression, because depression is not caused. Depression can be influenced by your surroundings and where you're living and what you're going through in your life. But a naturally cheerful person will rebound back to their cheerful state. Something will pull them down, they rebound back. When someone is suffering from medical depression, they will stay depressed, and you will try to pull them up, and they will come back to depression until you can readjust that set point. That takes a lot of cognitive behavioral therapy, sometimes medications, it takes exercise, taking good care of themselves, and a purpose, right? Viktor Frankl wrote a book called Man's Search for Meaning, and it's about his experiences in the Nazi concentration camp. And he developed a type of therapy called logotherapy. So logos is the Greek word, which literally means the word, right? Logos. But what they used it for in the Greek language was more as the word, the purpose, the meaning. And so he felt people needed to have meaning in their life. So logotherapy is where you help people find their reason for being. When someone comes in depressed and they say, oh, I think I'm going to kill myself, and they're in the ER and I'm talking to them, I say, oh, well, man, that's sad. Tell me what's going on. They tell me their story. I say, oh, it's terrible. You have any kids? Yeah, I have 2 kids. How will those kids feel if you do this? They will feel like you felt, that what you were going through was so terrible it wasn't as good as a chance of being with them, spending time with them. Surely they mean more to you than that, and you can find a way to get through this suffering for them. They're going to suffer horribly if you do this. They love you. Hugely effective. People may not care about saving themselves, but they'll care about saving their children. They'll care about saving others. And that's why sometimes those who are the most troubled are the ones who do some of the most good in the world. Mother Teresa, believe it or not, was an atheist. A lot of people don't know that. If you read her book, she was an atheist. All the suffering she had seen had caused her to lose any faith in a divine, all-powerful benevolence. But she did all kinds of good because she wanted to moderate the suffering she could see, right? So it's important to realize that sometimes when people are suffering, helping others is a great way to break out of it. And that's why we see so many excellent addiction counselors that have had trouble themselves, right? They've been through hard times themselves. That's why we try to build organizations of nurses and doctors that support and help other nurses and doctors and other professionals, psychologists and all that. And sometimes it becomes punitive. Sometimes the state organizations become punitive. I can tell you right now, you do not want to be a doctor in the, Doctors with Problems program in my state. So when someone is completely unforgiving, unwilling to look at the possibility that someone might be mistreated, always understand they're normally covering for something, right? They're normally, there's something, they're trying to distract everyone from them. Don't look at me, look at that person. That's the bad person over there. So we should always be accepting and tolerant. We should always understand that the person in front of us is a unique individual that needs help and that has come to us for help. And even if they're annoying, right? How hard must it be to go through life as annoying as some people just naturally are? It's not easy. So we should have sympathy for them also. Quite often you'll have people speak disparagingly about people without a high education, or perhaps who are not, maybe their IQ is not that high. And they're saying, oh, this person's that. Why despise them for it? Right? That's a burden they carry. It's incumbent upon those who are blessed with other skills to try to help pull them up, not kick them down. Because no matter how smart you are, there's somebody out there smarter. Any boxer will tell you that even if you're the world champion, that was just that day, that time, that fight. There's somebody out there that can clean your clock. You just haven't met him yet, right? You keep in the game long enough, you will. So it's important to remember that. You two have a beautiful day.
Thank you, Dr. Clark.